Well, good morning, everyone, to the session on social participation. My name is Herwig Ostermann. I'm the director of the Austrian National Public Health Institute, and it's really our pleasure and our privilege to have you here in Gastein and also online for this session on social participation. For those of you attending online, it might be a bit fussy in a way, because we've organized a fishbowl discussion and all the seats are placed around the speaker. So it's really 360 degrees, basically. It's including everybody. And when I entered the room, I actually figured out that this fishbowl setting very much takes up the motif, the logo of the Health Forum Gastein. And this is also linked to participation and plenary. So we're really branding Gastein here in a new way in this session on social participation. What is it about? It's about including people. It's about improving health systems. It's about, taking into the consideration of the public. And we know that participation is high on the agenda. It's not high on the agenda because of the pandemic. It's not high on the agenda because of the World Health Assembly resolution, but obviously these things help to bring participation on the agenda. But when it comes to health systems as such, it's always about including the public. It's always delivering public value. It's always about the well-being of society. So the concept is really deeply rooted in the way we organize healthcare, we organize health systems, and we organize public health. But what was important then onwards from, so to say, the pandemic and the World Health Assembly is that social participation came also into the mindset of decision makers. And this poses some challenges to us. It is the question on how to organize participation properly. And I'm very delighted that we have 4 excellent speakers with showcases, with expertise on participation. We will have a deep dive into the challenges, also into potential pitfalls of social participation. And hopefully at the end, we all are here very fond of our new project and think on how we can integrate and include the public into our future work. I'm here now to present our speakers. First of all, our moderator, Deepa. It really is a pleasure that you could join us here in Gastein this morning. Deepa is one of the authors of the WHO Handbook on Social Participation. It's a huge publication with 250 pages. Yeah, so. But just, to make sure, I think really, so after the session, I invite you to download the publication and go even more into detail. Michaela Moser from the Fachhochschule St. Pölten, University of Applied Science. Michaela did a study on social participation, which was the basis for the projects we then delivered at the Austrian National Public Health Institute. We have Giovanna Marsico. She's from the Center for Palliative and End-of-Life Care in France. Gonçalo Augusto from Portugal, from the National Health Council Secretariat, and Amanda Bock she's a patient advocate from the Synergist in Belgium. And now time is running. We have prepared a Slido questionnaire, and I'm happy now that I can see it on the screen. So I invite you, you're all familiar with this kind of tools, to actually, participate in the Slido. The results will be shown afterwards, and the questions are on the screen. What do you think is the most important element for participatory processes to be implemented successfully? Is it the mindset change of decision makers? Is it high capacities of decision makers to facilitate participation? Is it a dedicated budget? Is it strong civil society environment? Is it the legal obligation to undertake participation? Or is it strong relationships and partnerships between communities and policymakers? And with that, I now have the pleasure to hand over to Deepa. Deepa.
Thank you, Herwig. And thank you, all of you, for being here today. My name is Deepa, as you heard, from the European Observatory on Health Systems and Policies. And so today we want to explore the question of, are decision makers ready for participation? And this is perhaps in a way a provocative question, because what does that mean? It means that those who are in power, who influence decisions, the decision makers, might have to redistribute that power to others, to people, to communities, to civil society. And are we ready for that? Are decision makers ready for that? So in this session, we will hear from decision makers, as you heard, from the Portuguese National Health Council, the French Center for Palliative and End-of-Life Care, but we'll also be hearing from civil society advocates and from academia. And we'll kickstart this session with a keynote presentation by Michaela Moser of the St. Pölten University of Applied Sciences. Michaela was mandated by the Ministry of Health of Austria to look at the feasibility of whether citizen participation, public participation whether it's feasible to integrate it into the Austrian health system. But before we hear her presentation, I'd like to just clarify, what do we actually mean by social participation? In May, we had a World Health Assembly resolution, which Herwig mentioned, that just passed, and it calls on countries to do what? To systematically integrate participatory processes into the modus operandi of the health sector. Because what we have now are ad hoc processes or processes within certain areas of health, one-off processes, and the idea with this resolution is to call on countries to institutionalize it, to systematize it, to really make it the way we work in the health sector. So we're talking about a proactive embedding of participation in health. And this means this is for decision making, for implementing programs, for planning, for monitoring, really in the way health systems operate. And how do we do it? Well, Michaela might have some of the answers for us in her feasibility study. Over to you, Michaela.
Thank you. Yeah, welcome to everybody, also from my side. I'm trying to approach all of you in this setting here, which is very inclusive, but also a bit challenging for the speaker, but it's great. So, yes, if there's one thing that you are taking away from this keynote of mine, it's the sentence, participation starts with a C. So, of course, this is not a spelling thing. Well, obviously, when it comes to spelling, it doesn't start with a C. But when I was preparing for this keynote, I found out that there's really a lot of elements to participation that start with a C. So this is what I want you to take home from here. Participation starts with a C. Because in order to start this really deep, systematic, serious participation process, I think you need a lot of conviction. You need to be convinced, really, that participation makes a difference, that it has an impact. You need to have a lot of commitment in order to bring it through. You need to be open for change. You need to have a certain amount of curiosity, because participation processes also have some unpredictability always in them, and that makes them quite exciting, but also challenging. And of course, you need courage. So, and I think I have to ask someone to click, because I have only 2 arms, on the green button. Thank you. One back on the red, yes. Yeah, so we did this feasibility study in 2 parts at the University of St. Pölten. I don't want to go into the details of the research process. This is just a picture that gives you an overview of the different elements. Of course, we did literature research, we did look at best practices, but especially we did a lot of workshops, because we wanted the research project itself not only to be on participation, but also be participative itself. That's only consequent, I think. You can click. So I think one of these big C's that are so relevant for all participation processes is clarity. You need a lot before starting a participation process, but also in the participation process, you need to clarify a lot of elements. Some of them are listed here. It has to do with representation, who is participating in the process, who is selecting the actors, in which way, so that This is clear to everyone. The commitment also needs to be quite clear. What kind of process is it? Will the decisions that are made in this process be binding? Is it a consultative process, etc.? The commitment that is behind this process needs to be clear when it is started. Of course, transparency is also one of the things that need to be clarified. You need to document the process. You need to give written information to all the people involved, or information in the way that they can access. Maybe it's not always written, not for everyone. You need structure and organization. Participation processes are demanding. They are complex often, so you need to think very well about the structure and the organization of the process. And of course, you need financing. You need resources. Maybe not only money, it's also personnel resources, etc. Click, please. I think the most important thing to clarify is to have a shared understanding of participation. You see here on the right a participation pyramid. Many of you might know participation ladders. There is different levels of participation, and it has to be clear what are we talking about when we talk about participation, because this can reach from an information process over a consultation process, or it comes to co-decision making or co-creation. Another important C word when it comes to participation, to move from the invitation to participate to a really collaborative, co-creative process. Next. So having said all this, I just want to briefly resume the results of this study. Of course, we were not starting from ground zero with this study. The study is based on previous studies, desktop research on best experiences and practices in many countries. But many of the results that we found, they were backed up and they were strengthened by what the participants in the participative research process came up with. And they came up with 3 concrete recommendations to strengthen citizen and patients' participation in the Austrian health system. I start from below. So one of the recommendations was to have some kind of online portal providing an overview of participation processes and actors in Austria, because a lot of things are happening, but not many people, or maybe no one knows what is happening. So it would be really good to have a better overview, and that's also fulfilling the transparency goal. Then the second recommendation was, and the recommendation mainly come from representatives of self-help organizations, of interest groups, of vulnerable people, marginalized people, but also from participation experts that were consulted during this study. And we were not only consulting participation experts from the health field, but we felt it would be good also to reach out to participation experts from the climate sector, from the youth sector, from all the fields that are also quite involved in this participation issue. So the second recommendation was to have some sort of forum where citizens and patients, self-help and interest groups and their representatives can meet and can discuss things. Because it's nice to have an online portal and have an overview about all the things that are happening, but in the end, it's very much on interaction, also on negotiation processes, on consulting with each other. So you need some sort of forum of roof, as it was called in the process, to come together. And the first or third, depends where you start from, recommendation was to have some sort of coordination and competence center that bundles and strengthens and also accompanies participation processes in the healthcare system, a sort of place, an office, an agency, a department, however you want to call it. I think that doesn't matter so much, but somewhere where there are competent people that have an overview, that have a coordination task, that can do some capacity building, and that can support participation processes and help implementing it in a systematic way. Next one. In the second part of this study, after coming up with these 3 recommendations, we felt we should concretize these recommendations. So we had another series of workshops, and in this part we had workshops with a mixed group of actors. And I think this was also very valid and very good to bring together in the process already different actors with that contribute different perspectives, because that's also always very important for participation process, that you have, yes, the self-help group, the interest groups, the patients, the citizens want to consult among themselves, but it's also important that there is direct interaction with health professionals, with decision makers, with the administration, and so on. So in this workshop, where we try to include representatives from different fields and levels, there were somehow these recommendations were discussed again, they were confirmed, and there were some additional recommendations. One was a swift implementation and a further development in the process. Of course, that's evident. If you develop something in a project, you want it to be implemented and not only in a nice paper. Then a good anchoring across Austria and a strong commitment of the federal states. This has to do with the political system of Austria. You have to bring the federal states on board also, otherwise it won't happen. I think all of us from Austria who are active in the health system, we are very aware of this, and it's also true for the social system. Then there need to be some guarantee of far-reaching independence and financial security. Of course, this is a matter to discuss. What was meant is that the self-help groups, the interest groups, that they can discuss things in an independent way. Of course, everyone is aware that at the end of the day, you have to negotiate with those in power, so it's not a naive recommendation, but you need this space where you can independently and freely discuss and develop things. There needs to be the best possible ability to act through good networking with politics, administration, patients and citizens. So this goes back to this idea of the big forum, of a network that also goes across different actors. Transparency and inclusion need to be core values. And finally, I think, and that is also a sort of overarching recommendation, and it is a sort of claim and a goal, I think, at the same time, is that in the end it's also to contributing to a culture of participation, also beyond the health sector. Because I think every one of us involved in participation processes, we know how much it is about attitude, or how much it is about, I would say, culture meaning the way we do things. It has to become a sort of common thing. I think if we want to really move forward, and the results of this study support this, we need a strong culture of participation, so that it's not a very special extra thing that we are talking about, but that it's, well, the sort of normal way of doing things is that we do them not only in a participative, but, and here come we back to the C, in a collaborative way. And so I hope also this forum here today will contribute to such a culture of participation. Thank you.
Thank you, Michaela. So we have a lot of C's there. I really like that, the culture of participation, that it's a common thing. I think this is exactly what I was saying before about it becoming really a part of the way the health systems work. So we're going to kickstart our panel here, but as you see, this is a fish bowl, meaning you are all looking at us, the fish in the middle, and it means that we want you to come in and become fish now and again to join us in this discussion. That's why we have an extra seat, and we will ask some of you, members of the audience, to come and sit and maybe take part in the discussion, ask a question, and then go back to your seat, and we'll let somebody else take your place. So let's start with you, Gonzalo, from the National Health Council of Portugal. So for those who don't know the National Health Council, this is a body that is an advisory body, official advisory public body of the Ministry of Health that was founded in 2017 and has a legal framework attached to it and has fixed seats for civil society. It also has fixed seats for health professionals and government actors. But through the fixed seats for civil society, it's supposed to build a bridge between the ministry and people. So Gonzalo, it's only been in place a few years now. Tell us, what do you think about, or tell us one key achievement and some of the things that the Council is struggling with.
This works?
It works.
Thank you. First of all, let me thank for the invitation and for the Austrian Public Health Institute to put this session together. It's quite important to talk about participation, but more than talk, to make it happen. So I would say that the National Council is a very young, a new body in the health sector in Portugal has made slow steps to be known. Right from the beginning, the biggest concern was to achieve some reputation. The National Health Council actually produces annual reports and issues recommendations to the government, and we wanted to pick the best issues to address the reports and to make at least the moment of the report to be on the media and to have impact. The ministry is usually goes to the launch of the report. And that was actually one of the biggest achievements, that very quickly the National Health Council, even if some people don't know about the Council, but in the news, the National Health Council has some reputation of independency, and that was important to have an independent body issuing recommendations and not being afraid of recommending the government or certain actions and say that this is not well done, you should correct this reform was not implemented, you should come back to that. But our 6 representatives from patient associations are the most active members of the Council, not the professional associations of doctors or nurses and so on. The patients' associations are the most active. They are appointed by the Health Commission in the Parliament. So they are every 4 years. This is a non-renewable term, and the 6 representatives new 6 representatives are appointed. The Council now struggles with this issue of making it more democratic and to reach local communities. So how can we, at the local level, people get to know the Council and they have the opportunity to speak and to have some interference in the health policies for them in their local communities. There were a lot of health reforms that were enacted in Portugal very recently. I wouldn't say that they were at all participatory, so many people were complaining after the reform that they are not happy with the transformations in the networks of hospitals or healthcare providers and so on. So I think it's slowly, it is true, political decision makers, ministers and so on, they are understanding the importance of participation. The participation enriches policies. They can calibrate the policies to be better accepted and also better designed to achieve the results. The Ministry of Health last week was in our meeting at the National Health Council. She listened to the members of the Council and so on. Of course, very cooperative complaints. Doctors say, the doctors should be considered, nurses should be considered, oral health should be considered, and so on. But what she asked, there was a patient charter in Portugal for participation that was never regulated for ages, for almost 10 years. And finally, the minister last week said that she will request formally to the Council help in regulating this charter for health participation. That's important because our members were also very keen in complaining about this is missing for a long time, and we should do this. We should get this done. So this will be the next big task for the National Health Council.
Okay, thank you, Gonzalo. So we see there's some key achievements. You did mention getting visible very quickly, but then also some challenges, like really still reaching out to communities, even though you have all these civil society organizations, patients' organizations sitting on the council. That link further down is still a challenge, and I think this is an issue that a lot of people grapple with. I think this is an issue in France as well, with the end-of-life care consultation. We'll come back to that topic, but I wanted to maybe just look around the room and see if anyone has any comments or questions for Gonzalo or what was just said, commented. Would anyone like to join us here in the fishbowl? I see some familiar faces in the room. Yes, please, come. Can you state your name and your affiliation and take a seat and ask your question?
Thank you very much. Is that working? Yeah. I'm Charlotte Marchandise. Yeah, I did fishbowl, but this one is really wrong. Sometimes we just do half fishbowl. I'm Charlotte Marchandise. I'm the Executive Director of UFA, European Public Health Association. But I've been in policy making and did a lot of participation. But what what I don't see, and sometimes I think it's missing on all the principles, is the very day-to-day things. Like if you work with people with mental health disease, you cannot do it with very early morning, because when you're using psychotrops, you cannot wake up at 9 o'clock. So conditions of participation are really concrete things. If you're working with deaf people, I mean, I don't know if National Health Council systematically has interpretation for deaf people. Otherwise, it's not meaningful participation. And all these details are taking money and time, but there's like the necessary conditions. So it's all the time like the very concrete thing that if you have participation, you can implement them. And sometimes we're too high on the principle and not really on their life. And last thing, I would really like to hear you about impact, because I'm French, we voted some months ago and with no impact. And when it comes to participation, no, I mean, how can you tell people it actually does something? Thank you.
Thank you. So, impact, a very important question. And I think I might direct that at you, Giovanna, because Giovanna is the head of the Center for Palliative End-of-Life Care in France. You will probably know, as a French person, that there was this huge consultation process over the last 2 years on end-of-life care, Macron-backed, very, presidential, political issue behind it because of an end-of-life care law. So tell us about impact and how the results of this participatory process are going to be taken up into the law. What did you do to make sure it's not a tokenistic process, especially being so political?
Thank you for the invitation, and thank you, Charlotte, for making me cry about the results of political issues in France. I'm Italian and French too. So talking about the convention has been a real moment for democracy in France. And it took place between December 22 and April 23. There were 184 citizens randomly selected, coming from all over France, and they were supposed to answer, with a huge work, to answer to a question proposed by the Prime Minister: is the actual framework of the end-of-life care adapted to all circumstances, or a change must be done, must be introduced? And the aim of the convention was not to write the law, but to participate to the information base of the members of the parliament to feed the process of drawing the law. And in order to ensure that this process was honest, was sincere, was transparent, we built up a solid governance. a governance which was represented by a governance board, and I was member of the governance board. And we were there really to ensure that the process was not tokenist, but was really sincere, and to ensure the neutrality and the transparency of the process. So I can underline probably 3 points in order to show the difficulties, the obstacles, and also the success of the convention. The first one was the question of visibility and the support, the political support. Due to this huge visibility, media visibility, and the backing, the presidential backing, the political backing, we realized very early that we had a risk of instrumentalization. And this risk, of course, we had to face it with the governance and with transparency. Or if governance was really solid, but this one has been also a sort of physiological, natural result to bring together the members of this governance, but it's very challenging also, the choice of the members of the governance, and especially the question of transparency, because transparency is needed, but the members, the participants of the convention, need also some sort of protective space in order to discuss, in order to express their opinions, especially on an issue, a subject as the end-of-life care, which is really sensible, really sensible. So we had to balance those elements in order to assure people to discuss freely and honestly, and not to be criticized or processed by the exterior, by the world, by the society, and at the same time ensure the transparency. The second point is the risk of feeling of concurrency from the institutional democracy. The members of the parliament at the beginning were very criticized about the convention because they felt to lose their legitimacy representing of people. So this is a point that we didn't anticipate, and I think that it's very important. It's necessary to work on a communication and to show, even with research works, that institutional democracy and participation, they are complementary, and also they go forward because they strengthen democracy. And the third point is the question of equity and inequalities, because even if the conditions were very good, we received citizens in a wonderful place, the Palais de Iéna, wonderful place. They really felt overvalued, and we gave them compensation for work-off days, for babysitting, for transportation, of course, for hotels and everything. They were received in the best way. But still, we realized that the majority, I would say, the biggest percentage of participants, they came from privileged underground and educated underground. So this point also, it's very important. We need to ensure that people coming from more distant communities, they need to participate. They need to be to to be involved in order to ensure a really inclusive and respectful participation.
Thank you. So even in the best of conditions, we see even when we compensate for transport, compensate for time off, babysitting, it's still hard to get the communities that we want to reach, where the health outcomes are the poorest. And Charlotte, you also alluded to this, that probably we need to take a series of measures and they need to come together to make that work. Do we have any comments, questions from the floor? Anyone wants to join us in the fishbowl? Sylvia, please. Can you introduce yourself and your affiliation again?
Yes, thank you very much. My name is Silvia Ganzerla, and I'm from EuroHealthNet, the partnership with public authorities at national level. I really would like to make comments because this topic about equity in consultation, I think, is fundamental. You mentioned that the consultations were done in a beautiful place in the middle of a beautiful city. Sometimes you need also to think about how to reach out the vulnerable communities, and they do have needs that are not always the same as, let's say, middle class. One of the suggestion could be to organize consultations also in urban area that are not central but are in the communities. So I really like the title of these sessions because it shifts the focus on decision makers. Sometimes we talk about the hard to reach. We should reframe the question is how policymakers are making sure that they are going to the communities, they are going to the vulnerable people. They make sure that one of simple issue, translation. Maybe some people don't feel comfortable about speaking in a language that is not their mother tongue. And then if they are surrounded by people that they might feel intimidated or they might feel they are judged upon, they just won't come to the consultation and they won't be free to express their needs. So there are like a number of techniques that we need to take into consideration when we want to reach out the people that typically don't show up at these consultations. And then another thing that I would like to bring up, because the topic is about decision makers, we should also think about how do we train public administration into being responsive. This idea of we've done the consultation and then, okay, we tick the box. No, consultation should be about changing the way public administration works. It's about change the services that are provided and be open to these changes. So it's a very different shift in the mentality, especially for a public administration that comes from traditions that is very hierarchical, top-down rules and regulations. It's about people understanding that they have to work together with the communities to co-create the decisions. And then a measure of the success of consultation and participations is to demonstrate to people what has changed in the final decisions, thanks to their engagement.
Thank you. So basically you're saying it's, decision makers need to shift their mentality, but in many ways the civil society also need to be empowered to be able to engage, to let that mentality shift happen. So it's really on both sides.
Two-way process.
Exactly. And that leads to decision makers being ready for participation. Thank you very much. That leads me to you, Amanda, actually. Since, Amanda, you're with a nonprofit organization in Belgium, and you've often said that civil society often comes in a sort of anger-based approach to these to government actors or to health professionals and with grievances, but action needs to shift to a more partnership-based approach, to really be in partnership with government to work towards common goals. What does that mean? And does that mean that we both need to learn to work together better?
Yes, absolutely. And I think if we look at the history of the patient movement within civil society, and I will say that that's the fundamental role of civil society, it's to be the watchdog, and it's to be the voice, and it's to be the signal when something is going wrong. And we saw that a lot decades ago. The HIV/AIDS movement is one of the movements that put patient advocacy even on the scene, on the stage, and necessarily so. But if you just look at that movement, you'll see how it went from grievance-based, justifiably, anger-based, again, justifiably, to activism, and eventually into a partnership mindset. And for this conversation that we're having today, I think it's very interesting for us to learn what can we gain when we see a partnership mindset really working. And we're talking about impact, and we're talking about evidence about impact. One of the best examples that I can share on partnership really working, and it's to do with the Cs, all of the Cs that Michaela mentioned today, it's truly collaborative. And it doesn't mean that we involve patients and we reach out to the unreachable and pull them in. No, it's actually just as hard for them to reach decision makers as it is for decision makers to reach them. It's about having a common project, a common set of responsibilities, because the flip side of power is responsibility. And who wants the sole responsibility for our health system, especially today? And in Gasten, we're talking about the challenges that the health system is facing. We want to share the responsibility, and we want to bring the strengths of every sector to make our health system more fit for its public social purpose, which helps all of us. And the best example that I can share is from Ireland, specifically in the hemophilia community, where for various historical reasons, again, I think something important to look at, back to Michaela's point, it's not the what we're trying to do or the how we're trying to do it, it's the why we're trying to do it. And it's the why we're trying to do it that will create the mindset shift and get people to want to go on this journey. So in this case, in hemophilia, as many of you know, patients were infected through their treatment products with HIV and hepatitis C and hepatitis B. And there were inquiries and massive public scandals. And to avoid such safety catastrophes happening again, patients were successfully included in co-decision making. So in Ireland, we have 2 patient voices that are on the National Haemophilia Council, deciding on the protocols, deciding on the treatment plans, but they're also on the product selection board, deciding on the treatment products. And the power of this is that they can say, this is what our patients need. This is how many surgeries they need. This is how much inhibitor induction therapy they need to overcome antibodies. This is how many children need to be on prophylaxis. So this is actually the outcomes that we're looking for and how we rate them against, for example, packaging or things that some people might think are important, but patients will rate differently. And then in an anonymized tender, they will actually get the outcome that is best for them. And surprisingly, and this is evidenced, they will save the state money. And a 16-year review of this process showed that in 16 years, there was cost avoidance of 175 million, which if we divide that over time is 10 million a year, which if we divide that over how we could invest in civil society and have the patients be capacity built and have that long-term financial autonomy and freedom to show up as partners, we can completely afford.
So participation not only improves health outcomes, but it saves money, increases efficiency. I see a hand over there. Please come up here. Please state your name and your affiliation and your question or comment.
Hello, everybody. This is a very interesting discussion. Actually, when I saw it on the program, I thought that it's exactly what we needed. I have a question because right now, at least when it... Yes, my name is Eleonora Vartumian, Policy Manager at the European Health Management Association. So my question is about policy making, especially on health. We know now from the Commission we have the concept of the European Health Union. Amid all the geopolitical issues that we have, we also see some restrictions from some governments, as you know, to talk about health, and especially to make sure that the voice of people is listened to. So as civil society, we're facing some constraints, let's say. We also have now the appointment for the portfolio of health. I don't want to make this discussion an activist discussion or political discussion, but I just want to think about the future and how we can have the essence of competitiveness, but also of this geopolitical disbalance in Europe. How can we make sure that our voice is still heard from those who might not be as open to listen to us?
How do we get governments to listen to civil society. Those who may not want to, who would like to take this? Gonzalo, Giovanna, from the government side.
In a very strictly way, is to have a good vote. We need to vote, and we need to vote well. And even if Charlotte underlined, we have the example in France. We went to vote, and the government is not representing the vote of people. So we realize that in this moment, political systems are quite challenging, quite difficult, and I think that one of the question is how to educate population, how to educate people to consider that health, for instance, is a real democratic issue. It's not just a question of professionals for doctors. I see in end-of-life care, for instance, France has always considered that end of life is a doctor question. This is the very first time that it becomes social issues, a democratic issues. It's the same for the rest.
Yes. Okay, so health is a democratic issue. Michaela, comment on it.
I wanted to comment on this question, and I think indeed I would come back to this working on this culture of participation, because if we are looking on research on the reasons why people vote the way they vote, and especially why they vote for the far right and for really authoritative and non-democratic parties. You look at sociological research and you see many of these people, they feel they are not heard. They feel that they don't have a voice. And then they are, we would say, probably falsely promised that there are people that give them a voice. But I think there is a very deep underlying reason of people feeling neglected, feeling ignored, feeling that they don't count, that they are not seen by the so far dominant parties, that they don't have a space. So I think it's not an immediate solution, but I think on the long run, a culture of true participation, the experience, and I think it's not only about a vague promise. People have to make the experience that they are listened to, that they can make a change, that what they are saying, what they are contributing is heard and taken into account.
Very important point, and there is going to be a plenary on this at Gastein, at the plenary one, so calling on all of you to attend. I see Amanda would like to comment, and we have a few hands in the room. Go ahead.
I agree with everything that has been said completely, but I would add the additional angle that health is also an economic issue, especially in today's market economy, and building on what we heard at yesterday's sessions. We are investing in the most important capital that we have, which is our human capital. And if I can even be a little bit polemic, if we draw that argument to its natural conclusion, health is an investment in security.
Exactly. But we also hear that, okay, so participation is necessary for people to feel heard, and if they are heard, they will vote. They may not vote in a certain direction. Participation is all about collaboration between the two sides and true cooperation, partnerships. Vesna, I see you really want to come into the fishbowl, because this is a topic that our Slovenian Ministry of Health colleague Vesna knows all about. Partnerships between government and civil society. How can we make that work? How can we make it something that is fruitful for both sides?
First of all, I'm so glad to be part of this discussion, because, you know, when I was actually very much involved in the process of social participation resolution, and this was high level, and it started by recognizing that we have so much work done by civil society organizations, those people that are really interested, but not that they are not heard in their governments. Even internationally, their potential is not yet recognized, while we are facing so many challenges. Like, tell me, if you can, who is going to actually work on health literacy, increasing health literacy in people? Is this health workforce? where we all know that, you know, they are overburdened already? Who's going to deal with misinformation? Who's going to be there in the next crisis to support people, to explain to people what's going on even, you know? These cannot be the government with all their institutions because they struggle already. So why is it that we cannot better work together, and especially why is it that we don't trust each other, you know, more? And in my little country, Slovenia, we realized that, you know, trust comes out of working together. But it's not always only sitting around the table and making decisions and listen to each other. Sometimes it is about doing real work on the ground together. You know, so when we were trying to improve our ways of working in primary healthcare, we developed special health promotion centers because we realized that prevention does matter and that we invest too little money in prevention. We realized in a couple of years that those free of charge programs are not attended by the most vulnerable ones. Why was it? Because the most vulnerable ones had a lot of barriers to come to those centers. We did an evaluation with people and we asked people, oh, why don't you come? It's free of charge. Well, maybe it's not for me. I'm not educated. You know, I'm too obese. I fear the programs are not meant for me. These kind of answers. So who could promote and bring those people into the services that are there for them free of charge? And we realized it's civil society working with them every day. You know, it's organizations like Caritas, Red Cross, but also organized youth, if we are speaking of young people, pensioners organizations, and patients organizations also, you know. So working together brought more trust, but still we had a lot of resistance with professionals. Because they said, oh, we cannot really trust civil society because, you know, they maybe do not do the evidence-based work. So we said, well, check it. Work with them, invest in them, train them to do appropriate work. And public health is very strong in Slovenia, as strong as primary health care. So we decided to have a little unit within Public Health Institute that will promote work with civil society, not to civil society, but to professionals in the Public Health Institute. While they develop all these guidelines, they should be implemented. Who is there for you to help you to implement with the most vulnerable? It's civil society organizations. So to build trust and to really progress, you need to systemize social participation. There are many ways of doing it. You explained a lot how you involve civil society in decision-making. What I'm saying is you also should invest in they having an important part in implementing programs. That is another part of it, and there the trust is built. So I wanted to say this.
So this is really, it's about co-creation, as you said, Michaela. So we need to build trust by, yes, getting people to work together, getting government and civil society and community organizations to work together. This is something I think you know a lot about, Antoine. Come, please introduce yourself and your affiliation and tell us your comment or question.
Thank you, Deepa. Am I allowed to swim in the fishbowl?
Yes.
Okay. So I like to look at the spectators, the participants. I'm Antoine, I'm a community physician in Canada, and I'm co-director with a patient of a research chair on partnership with patients and communities. This is exciting. This is a really exciting time, a really exciting conference. I think many of the comments really convey the importance of collaboration between civil society and health system, primarily because we recognize that health is created with civil society. You know, our health system are just producing about 20% of health. The rest is people helping one another. And so we cannot achieve health goals without working with them, not just as users, but also as creators of health. But working together is also scary. It's difficult. For me, partnership is a relationship. And it's a relationship between really different worlds. And we need to recognize the difficulty and the challenges. The world of policy making, which I know nothing about, or the world of medicine, which I know a little more about, is very different from the world of patients and civil society. For example, you are faced with the perspective of looking at health from my own experience to looking at health to our collective health. That's a big shift. The other difference is time frame. You know, one of my patient colleagues lives with HIV. He's lost many of his friends from HIV. And for him, there is an urgency to change the system before he dies. You know, that's his time frame for change. But sometimes changing institution and policy takes much more time. So there's a gap here. Sometimes the gap is the other way around. We're asked in many projects to demonstrate impact within a year. And some of the people I work with in Canada, for example, Indigenous communities, think of impact across multiple generations. And so that creates another gap and difficulty to synchronize our perspective and time frame to learn to work together. And for me, there are two helpful things to help work together. And the two concepts that I've found are really helpful is the importance of bridgers and the importance of participatory spaces. Bridgers, for me, there are people who can look at the world from more than one perspective. And these are people that you know. You know, they look like translators, ambassadors, diplomats, people who've lived in a country and lived in another one, who know that there is more than one way to look at the world, or patients who have also become health professionals, or researchers who worked in the policy world. And these people, like Amanda, like Deepa, like Vesna, have this ability to listen with different ears to the perspective of civil society and policymaker and help synchronize and understand each other. These people are really, really important to help us work together. The other thing is participatory spaces. So many times when we think about engagement, we think about inviting people from the outside into our world. We're concerned about literacy so that they understand our language. We want them to adapt to our ways of working together between 9 to 5, Monday to Friday, you know, in 1 hour meeting on Zoom. And you get people totally lost because they're in a really foreign world. And when we go into communities, we are lost too. We don't understand, well, who's the chief executive officer of the community here? What are the rules? You know, how does this work? It's really foreign. And so participatory spaces, for me, they are in-between spaces that we create. They are symbolic spaces where we learn to speak the same language. We learn to work at the same speed temporally and on common projects that we craft together. So this fishbowl is a participatory space. You know, it can be temporary or it can be permanent, like a health council or a national health assembly, or it can be created in communities. The last year, the best participatory space I've had was going into an Indigenous community, gathering for a full day around a stove and sharing stories with an elder, with a teenager who had lived with cancer, with his dad, with my colleague who's an hematologist who was cooking Brittany crepes. This is the space where we met and we started understanding each other and building relationships. So these are very important to start working together.
So we need more of these participatory spaces. And this is exactly, I think, what the Assembly resolution is calling on, that we need to create to bridge that gap between communities and decision makers. Go ahead, Gonzalo.
This is very important, and I just wanted to add something about what was said before, that we face this participation, when we were talking about politics and so on, with enthusiasm. Now we have to refill our democracy with something more, so it can be alive and good. In the last elections in Portugal, we all had elections, right? In last elections in Portugal, the participation we were seeing throughout the Sunday vote day was increasing. I said, oh yes, the Democratic Party, the people, citizens are engaged and so on. Later we realized that were usually the people that didn't vote, went to vote on the far right. So it depends what participation we are looking for. But it is very important that the decision makers understand this divorce between the health services and the citizens. We have health services that are prepared to work 9 to 5, but most citizens are also working at that time. So the health systems really need to rethink the role and the services. They are very slow. We don't like change, and people are always demanding better public, and very well. They are demanding better public services and adapted to their needs, and that is the biggest challenge, to do that quickly, because people feel that first their voices are not heard at all. They don't decide on the reorganization of their healthcare center or the obstetric services, pregnant women. We are now having a shortage of obstetric doctors. So for someone who is pregnant in Portugal, they don't exactly know what services are open or not. And they want to reorganize, to reform these obstetric services to have to solve the problem. I don't see anyone asking representatives of patients or users of the National Service what they think, how they should be organized. What is the role of something that never occurred to politicians? What is the role of a midwife? Because there are no midwives in Portugal. All babies are born with the doctors. So this is the kind of thing that could be discussed. So we are always pursuing new problems, but perhaps we should pursue new solutions, innovative solutions, involving people, and how to involve people, how to systematically have channels of communication with the and bidirectional communications. We sometimes need to ask them what they think. They sometimes need to complain or to tell us what we should do. This communication between our services and the population should happen pretty much locally, and that's why the National Health Council is trying to make some local routes, some kind of a pyramid where we could have the local, not the regional in Portugal, but the local and the national, and that communication could flow, and to really strengthen this participatory perspective of policies.
You're underlying what Antoine just said. We need those participatory spaces where that are easily accessible, where pregnant women can come together, for example, with the obstetricians and with health decision makers to talk about opening hours, for example. I see a lot of hands on this side, but I realize that I've ignored this side. If there's a hand here, would somebody like to come? Please come to the fishbowl, state your name and your affiliation and your comment or question. I'm running. No worries.
Okay, thank you. Hello, everyone. My name is Birgit Bauer. I'm coming from Germany, and I'm the project coordinator of Data Saves Lives Germany, a campaign who is explaining health data sharing to citizens and patients. And thank you for that really interesting discussion. I like the example from Serbia. You did it right. Slovenia, sorry. And it's very inspiring for me, but I miss one thing. Before we start to talk about participation, and I would love to have that across the world because it's so important to involve patients and citizens into that whole process. why don't we talk about communication? Explaining the health systems to the people. From my community, I know that very well. So they want to participate, but they don't know how, and they don't know how it works. How does a government work? So I was participating with Data Saves Lives Germany last year in creating a new law. In German we say Gesundheitsdatennutzungsgesetz. It's typical for us. It's about protection of health data, the short version of that. And it was hard to read because it's a law. It has its own wording, it has its own mechanisms, and also it's written by the people coming from the government, from the Ministry of Health. And then we brought it out and it was published and it's now ongoing, and people say, how can politicians make this law? And I said, guys, it's not just the Minister of Health. So Mr. Lauterbach is not sitting in his office constantly and writing laws. There is a team behind. And I think this is something we also have to communicate. We have to bring the knowledge, how does it work, to the people. And also we have to talk much more and communicate much more to the people to explain them what's going on. But there is no communication, and this is what I miss so much, because I think participation, also the meaning and also the value of participation would be much more clear also in people, what we mentioned before, that never had done to, or never had a thing to do with the governmental things, but they want to do something, but they don't know how, and this is the problem. So we have to explain it to them, and we make it understandable. So this is what I'm doing since November 2022. So I know how hard it is, and it's challenging, but it's worth to do it, because the more information we have outside and the more understanding of the citizens and especially of the patients we have, the better participation can be. I'm convinced about it. So let me know if you think different, but I think knowledge is key in that whole process. And I agree with you, Amanda. You say participation is also an economic factor. It is, definitely. And knowledge is the same. So I think we need to create knowledge, from knowledge to participation, and then we have this economic value also. And this is what we need, because we don't have the money anymore. Thank you.
Amanda, go ahead.
Thank you, Birgit. I love that you're here, and I love everything that you say. And I completely agree with you. And I would make the connection back to what Antoine said about bridgers, because I think that that is something. Birgit and I have known each other for a few years. That is something that people in the advocacy space do as volunteers. You jump in and you start creating the bridge. It's also something, incidentally, that we see needing to be done with the resolution, because we're saying the same thing, but we're using different words. And those words don't mean anything to patients. I've been screaming from the rooftops, so excited about this resolution, but it barely has the word patient in it. So a patient will say it has nothing to do with me, but it has everything to do with you. We need to translate that to them. So yeah, thank you for your comment.
Thank you. Yeah. Yes, I just want to add, agreeing with everything that has been said. I think with participation in praxis and in theory, information and communication is always the baseline in all the ladders and pyramids and theoretical models you have, but of course also in praxis. But I think I wouldn't say like information comes first and then participation. I think it's a sort of mutual influencing process, because if we create more of these participative spaces, and if we invite people and bring some people to participative processes that have never been there in form, these processes are also highly educative spaces. It's incredible. And I think especially if we do a lot in citizen participation, working with this inviting people by chance, so not targeting only special interest groups or self-help organization, but really just by chance, and then select the representative quota of people to come to these processes. And not everyone, but people are following this invitation, and people come to this consultation and participation processes, people that have never been involved in such a process before, and that the co-learning, and I really think again, it's important to have a co-learning because it's a learning process for everyone involved, is incredible. And what I think, and it includes, that's my last point, sorry, I think it also has to include that people can change their minds. That because our system at the moment is so that many of the positions are so ideological and are so fixed in a way that I think one of the big things and one of the great values of this kind of processes is that we can really learn from each other and that we say, okay, I have listened to you, you have convinced me, and now I have changed my mind, I see things different.
It's a really important point. Also, your point of co-learning, and I think again we go back to the participatory spaces. This is a space for co-learning, not only for civil society and communities, but especially for our decision makers to make them ready for participation. We have time for one last question. I saw a couple of hands here from the fishbowl. Okay, we'll take two. We'll take you, and you had your hand up, I think, for quite a while. Please come here, state your name and your affiliation, and then we'll do one last question and then go to the closing.
Hello, I'm Milena Ekonomou. I'm working with the WHO regional office in the Venice office. And earlier this year, we launched the Coalition of Partners on Health and Tourism, and we use a lot of participatory approaches. So thanks for raising the Cs, because I'm absolutely deeply convinced that this is actually meaningful participation is the driver for commitment and change. At the same time, we see that we still have a question mark there. And I would like to know, how can we actually assess while using participatory approaches and also evaluate afterwards that it's actually the participatory element that makes the change, that creates commitment. And then also, because we had a comment on the synchronization, I'm also deeply convinced that we live in a time where the major challenges are resulting from synchronization. So the ecological one is maybe the most obvious, where we have a desynchronization between the resources we use and of course, the acceleration of the processes, and then the nature not coming like fast enough to reproduce. But then also we have maybe a desynchronization in democracy and participatory exchange and the decisions that actually need to be made. So many times decision makers need to make a decision for a problem that maybe arose yesterday evening, today. And participation needs time. And how can we maybe overcome the desynchronization that actually results from democracy and participation and the solutions and the social change that are calling faster for action?
Thank you. I think a lot of this is about having participatory spaces that are already running and working, where they can be used quickly in service of some of these more urgent issues. Go ahead.
Probably also a participatory framework, a real participatory framework, because we saw that if patients and people can be accompanied towards the education, information, communication, the problem is those who don't want to change, those who are in a privileged situation and they don't want to change because their way of thinking and in deciding, it's good for them. So, and there are some communities who are in this situation. So we need to see also a trigger, and the trigger is the legal framework. We need laws. We need frameworks to push those who are well, you understood.
Yes. Okay, thank you so much. I see we're really at the end of time. We're having a networking break after this, right outside this hall. And so can I ask some of the hands that were here to maybe raise your hand again in the networking break and we'll take your questions there, I promise. I'll hand over now to Herwig to close us. Yeah. And thank you to everyone who sat into the fishbowl.
Well, first of all, thank you so much for this really insightful discussion. And there is the Slido. All right. So it's about strong relationships. And then the second one is actually the mindset change. High capacity of decision makers to facilitate participation ranks third. And then it is the strong civil society environment, legal obligation, and I think dedicated budget. We all learned that participation saves money in a way, so maybe the dedicated budget can be used then for more participation. Okay, ultimately, if you want to take an even deeper dive into participation, first and foremost, for those entitled to vote in Austria, there would be a chance to participate in a very important process this Sunday. So if you're still, in your decision-making process, going to the votes is also participation. The second thing is, if you want to take an even deeper dive, I invite you to download the WHO Handbook on Social Participation and maybe also the World Health Assembly resolution. Maybe start with the resolution and then go into the textbook. And ultimately, there is a networking break outside. And I just want to quote the last sentence of the invitation for this networking session outside, which is for on-site participants only, which is a bit of a pity, but still, participants will receive an ice cream to make it easier to look beneath the surface of the iceberg of participation. So, thank you so much.